attitude. Right. So now let's go to the second question over here. So this is the second question. Choose the most context appropriate completion. So among these four vocabulary words, you have to choose the right word over here. So this is the sentence over here. The patient responded well to the medication, but the physician remained dash due to the possibility of relapse. Right. So what could be the answer? Understand, here also you have to like understand what the doctor is saying. Right. Okay. Hi, Jeffrin. Thank you for logging in. Yeah. I think is there a network issue?
Yes,
Yeah. All right. Yeah.
am I audible?
Yeah, you're audible. Right.
Yes.
All right. So we are having, so we'll be discussing reading part B today. Okay. So before that, we're just having a small multiple choice question quiz. Okay. So small quiz like game. Right. So we have finished with the very first question. This is second question. So you can just type the answer in the chat box, whatever you believe is to be
Okay.
the right answer.
Okay.
Yeah. So the sentence over here is the patient responded well to the medication. So that's a positive indication. Now a contrast phrase is coming, but the physician remained dash due to the possibility of relapse. So from positive, the word but is coming. So it is going to be a negative information. So among A, B, C, and D, which do you think is the most appropriate vocabulary that will fill in the sentence? Ecstatic. Ecstatic means very, very happy. Okay. Ecstatic means very, very happy. Ecstasy. Okay. So that is, like usually drug addicts. Okay. Whenever drug addicts and all take drugs and all, the feeling they get, euphoria, ecstasy, we say, right? So that is what that means. Indifferent. Indifferent basically means no emotions. Okay. Having no hatred, having no positive emotions. Optimistic means positive. So the right answer over here is going to be D option, that is cautious. Now, why is D going to be the right answer? Because here it's a positive information. The patient responded well to the medication. Okay, so that means the medications are working very well. It's a very positive indication. Now, see, suddenly the word but is coming. So that is a signal. Okay, the word but is always going to be a signal. Now, from positive, a sudden shift from to negative information is going to come. Now the saying, even though the patient is responding well to the medication, the physician remained dash due to the possibility of relapse. That is, this condition can happen anytime soon. So it has to be a negative word over here. So the word is cautious. That is, we have to be very, very careful. Okay, because there is a high chance for relapse. Right. So now let's go to the third question. The third question over here. So these are slightly tough questions today, but it's interesting. Okay, so is it clear? Yeah. What does the phrase falling through the cracks most likely mean in a healthcare report? Falling through the cracks. So this is a figurative speech. Okay, so it's a metaphor, idioms, and all we say. So what is the word? Falling through the cracks. So imagine Imagine cracks, imagine certain things falling down. You have to visualize your imagination, and then you tell me whether it is going to be A, B, C, or D. Falling through the cracks. So, like maybe visualize, maybe in the terrace and also during the rainy season and all, we have a terrace, right? So the water will get logged in there. Now, what will happen if the terrace has certain cracks? The water is having certain cracks. What will happen? The water will leak, right? The water will leak down. Okay, so that is the context over here. So, right, so I'm going to show you the answer. The answer option is essentially answer option B, right? So B will be the more appropriate answer. So that is patient not receiving the care they need. Okay, so that is, okay, the patients are falling through the cracks. That is, it is not perfect. Okay, the healthcare system is not perfect. Okay, in everything has imperfections. Okay, so falling the cracks basically means the imperfections. Okay, so as I told you, imagine a terrace. The terrace has certain cracks. So the cracks are basically imperfections. Now, unfortunately, the patients are falling through the cracks. That is, the patients are falling victims to the imperfections. Okay, so that is the meaning. So that is the patient is not receiving the care they need. Okay, there are certain imperfections in the healthcare system, and the patients are falling victims to it. Right. So that will be the right answer option over here. So sometimes figurative speech, this is what we call as figurative speech. So sometimes even if this is completely new to you, you can visualize and then you can try to make a connection to the, healthcare situation. Okay. Again, these are tough questions over here today. Deliberately, very intentionally have made tough questions. So let's go to the very fourth question now. We have total 5 questions over here. All right. So this is the fourth question. Which of the following best reflects a critical but professional tone? So when you're writing a letter, here you have to choose the most appropriate answer. Which of the best reflects a critical means what? Critical means, criticizing. Okay, we are criticizing a person. Critical. Okay, that is critique. Critic means criticizing someone. That is pointing out the flaws in some people. Okay. But even though we are criticizing, we are not insulting the person. We are doing it in a very professional manner. So among A, B, and C and D, which do you think is showing criticism? But even though we are criticizing, we are actually maintaining a professional tone. That is, we are not showing our emotions, our negative emotions. So what could be the answer? The right answer option is B. Okay, so here B, as I told you, A is also correct. Okay, A is also correct. But what's the question over here? The best. Okay, so among A, B, and C and D, you have to choose the best answer option. Because remember, I told you we are criticizing a person. Okay, but even though we are criticizing, See, when we say, let's say that you go to a restaurant and maybe you order food and you're not getting the food on time. You waited 20-30 minutes. So you're going to criticize the staff, right? So how will you criticize? There will be a lot of anger in you. Okay, there will be a lot of anger in you, and you will be criticizing. But in a professional way, how can we? So, professional tone means you're still criticizing, but you're not showing your emotions. Now, see, when it comes to answer option D, now see, the initiative was obviously never going to work. So, see, it is not very professional. That is, it shows your emotions. Okay, it is never going to work. Now, see, it is an embarrassment. The initiative was an embarrassment to the institution. So, this is also criticism. This is also criticism, but it is not entirely professional. Now, when it comes to answer option A, here also judgment. Okay, here we are judging the person. Okay, so it's very poor. Okay, the initiative failed because of very poor management decisions. Right, but when it comes to answer option B, so see, a little bit professional. The initiative showed promise. That is, yeah, it had some positive aspects to it, though implementation was inconsistent. So see, we are criticizing them. Okay, it was a very good initiative, but the implementation was not properly done. So here the criticism factor is there, but at the same time a professional tone. Right. So A is also correct, but B is a little bit more appropriate answer. Right. All right. So we have yes, Dr. Arora here. Hi, doctor. Right. So now let's go to the fifth
Hello
question.
everyone.
Yes. Hi. All right. So here, yeah, let's go to the fifth question for the day, the last question. So yes. So this is the question over here. He's stable for now, but I would not call it a clean bill of health just yet. How does the speaker most likely feel? So here you have to identify the attitude, the feeling of the speaker. Clean bill of health. So this is a figurative speech. Clean bill means there is no hospital bill and all. Huh? They're not talking about a literal hospital bill. They're actually talking about health, very good health. Very good health is what we call as clean bill of health. That is with no problems. So how does the speaker most likely feel? You can type your answer in the chat box.
Follow B.
Mm-hmm.
I can't see my chat box.
Right. So what is the answer going to be? So what is the beginning part of the sentence? The beginning of the sentence is positive, right? He's stable for now. The patient is stable. Very good thing. Now the word but is coming. Now see, the but is always going to change. It is always going to signal a change. That is a very sudden change is going to come. So from positive, suddenly a negative change is going to come. Stable for now, but I would not call it a clean bill of health. That is, even though he's stable, I don't feel, the speaker is saying, I don't feel he is very healthy right now. Okay, even though he's stable now, I don't feel he is quite healthy. Right, so the answer option is going to be B option. Right, that is slightly doubtful and cautious. Right, so B will be the right answer.
Shrikant,
Mm,
in this question, when we are thinking about he is stable is a positive note. Like
mm,
we are thinking in a positive way. He is
mm,
stable for now.
mm,
Now, when we are using but, however, and I think these things, they certainly, as per your version, we certainly say
mm,
changes their context and their contrast phases.
mm,
So, and the next thing will be a totally negative, right?
mm.
As
Yes.
as we just guess, as we predict. But when
Mm-hmm.
we are reading answer B, though I also mark the B only, which looks more appropriate,
Mm,
slightly doubtful. It is not 100% positive. It is just a okay, it might be, and cautious.
mm,
So what I mean to say, ki, like we are getting a mixed response, but
mm,
we are not getting like positive response with the first sentence, and then the contrast phase, and then the sudden negative response.
mm. So anyway, this is multiple choice questions over here. It is not short answer type questions. So when it comes to answer option A, C, and D, can we choose A, C, and D? Can we choose optimistic and certain? We can't. Can we
That was
choose,
negative, yeah. That
yeah,
was
can
not
we choose
possible.
confident and relieved? We can't. Can we choose frustrated and dismissive? That is extremely extreme. All right.
Right.
So, yeah, so we are not dealing with short answer type questions. So here you have to choose the best answer option that is given over here. Right. So here it is saying the patient is stable enough. He right now his condition is stable, right? But still we have to be a little bit cautious. I don't think he's having a clean bill of health, even though he's stable now. We have to be a little bit cautious, and I'm still doubting how stable he is. Things can relapse. Right. So among A, B, and C and D, B is the right answer. So yeah, if we are going to be very, very particular, then yeah, instead of A and C, we can bring in some other more appropriate words over here, and that will be the right answer. But in this case, it is multiple choice questions. So we just have to go with B if that is more appropriate here. Now let's take one reading part B. So reading part B are basically multiple choice questions. And when it comes to multiple choice questions of reading part B, we will be coming across workplace extracts. So see, when we are working as a medical professional in a hospital, we will be getting, certain workplace documents, right? Like for example, we will be getting emails from the hospital. We will be getting memos from the hospital. We will be getting guidelines from the hospital. No, has the question never. It will never repeat because even so, when it comes to OET, the questions, see, we have only very few sample materials over here. The questions will never repeat, and even if there is going to be repetition, it is not going to be anytime soon. That is, for example, the question paper that was given in that has been given in 2025. So, for instance, you're writing the exam on July 9th something. So if you're writing the exam on July 9, that question paper will be maybe repeating after 5 or 6 years, because then it will lose its value, right? OET is an internationally recognized examination. They cannot afford to repeat the same questions, because it will directly affect their reputation. So the questions that you get over here will not be repeated, or even if they're going to be repeating, it will be repeating only after several years. So that is but the pattern, what is going to repeat? The pattern is going to repeat. Okay, the exam format. Okay, so the similar type of questions. So for instance, over here, what did I say in reading part B? Reading part B, there are going to be 6 multiple choice questions. All 6 questions are going to be completely different from each other. And not only that, the 6 questions will be coming from workplace extracts. So when workplace extracts basically means, a document, an extract from a document that has been given to a medical staff working in a hospital. So it can be an email. It can be an instruction manual, like, how to operate a medical equipment, like an instruction manual. It can be a guidelines. So, when we are working as a staff in a hospital, we'll be getting guidelines, we'll be getting policies, rules and regulations and all that. So from those documents, small extracts. So our duty over here is to understand the question and also understand the intent of the workplace document. Okay, so that is what it is going to be, and there will be 3 answer options. There won't be 4 answer options. In part C, you'll be getting 4 answer options. Here, there will be 3 answer options, but still it is going to be slightly complex, right? So, all right. So, how about Jeffrin? Your exam's coming very, very early. That is on 9th, your exam is coming. So, from here, why don't you choose any one, um, question paper from here? You can choose any one: cellulitis, diabetic foot ulcers, pediatrics, fractures. Yeah, Jeffrin, you can unmute yourself. You're there.
Yes, let's do
Mm.
fractures today.
Okay, so let's take fractures. So the good news about reading part B, not entirely sure if it is good news and all. There will be 6 questions. All 6 questions are going to be completely unrelated. That is 6 questions, 6 different extracts. So we can randomly take any question. So it is not going to have any much difference over there. Right. So let's take a look into the part B questions of the fractures document. So reading part A, there will be 4 text, text A, text B, text C, and text D. Almost 700 words will be there, and you will be getting 20 questions. You will be getting mastery following questions. You will be getting short answer type questions, and you will be getting fill in the blank questions. And you have only 15 minutes. So make sure you have very good time management skills, right? So that is extremely important. So here the strategies are very, very different. But when it comes to reading part B, we have a particular set of strategies. And let's see what those strategies are and how the part B examination works. So one thing I want to make very clear, those who are writing the pen and paper based OET, those who are writing the pen and paper based OET, you will be getting 15 minutes time to finish reading part A. And after 15 minutes, they will take your reading part A question paper, and then they will give you the reading part B and reading part C question paper. So there will be total of 22 questions. Combining part B and part C, you will be getting 22 questions and you will be getting 45 minutes. Okay, so 45 minutes for reading part B, and you can do maybe reading part C if you want. So if you want to do reading part C first, you can do reading part C. And then once you are finished with reading part C, then you can come and you can do reading part B. For computer-based OET, the format is little bit different. There, I don't think we have that much freedom. For example, you'll first you will be getting the listening part A question. Okay, so you will be getting a listening part A question, and immediately instead of getting listening part B and listening part C, the computer folks will be getting reading part A. Okay, so this is the format: listening part A, and instead of listening part B, you will be getting the reading part A. Okay, and then after completing reading part A, you will be getting listening part B, listening part C, and then comes reading part B and reading part C. Okay, so there also, I believe reading part B and reading part C will be given separately to you. So there also you can scroll. You can scroll, and if you want, you can do the reading part C questions, or you can do the reading part B questions first. And for doing the computer-based OET, I would also highly recommend that you log into the OET website. And once you log into the OET website, so this is something that everyone can do, not only the computer candidates. So just type in oet.com and click on, I think I believe it is going to be test. Yeah, so click on test over here. No cut test. Okay, yeah, you have to click on ready. Yeah, click on ready, right? And then click on sample test. And then you click on OET test on computer, right? So click on ready, click on sample test, click on computer test on computer, OET test on computer, select your profession. Okay, so let's say that you want to begin the nursing profession. And here you can see there are 4 sample tests, right? So you can actually, this sample test will have listening, reading, and writing. So if you, so those who are writing the computer-based OET, if you just want to become very, very familiar with how the computer-based OET is, I would strongly recommend you do this. You log into the OET website, click on ready, and you can do the sample test, right? So perform very nicely, performing, because sometimes if you log in, I would suggest that you do not log in first, because if you log in with your email ID and password and all, and then if you do the sample test, then your score will be recorded into the website. So if you do not perform very well on the sample test, the OET people will remember your scores. That is, okay, this candidate did do 1 or 2 sample tests, but did not do very nicely. So on your examination day, when you go and where you give a very good performance, then they may tally up. They may tally your real exam performance and your sample test performance. Again, this is my theory. I'm not saying it is a possibility, right? So unnecessarily do not take a risk. Okay, so you have to definitely do the sample test, okay, but do it without logging in. Okay, so that your the OET does not know that it is you who actually did it, right? So it's something to just keep in mind. Again, just a theory. I may be correct, I may be wrong, but this definitely will help you out. because the more familiarity you have, with practicing the sample test, the more better it will be when you're attempting the exam on the examination day. Right. So now, when it comes to reading part B, if you ask me, many students say reading part B is easy, because why is it easy? You get, just one tiny paragraph over here, and we have one answer option. We have one question over here, and we have only three answer options. But when it comes to reading part C, okay, there we have very, very long, lengthy, complex text over here, and we have questions with four answer options. Okay, but I personally find part C little bit more easy sometimes. Okay, compared to part B. Again, part B also has very easy questions, but sometimes there are going to be very complex questions in reading part B. It may look very innocent, but sometimes I feel that part B questions are slightly more complex. So do not underestimate part B questions, even though it may look very, innocent over here. Right. So let's practice random questions over here. Okay. So anyway, let's talk about the strategies. So this is multiple choice questions. So what is your duty here? Your duty here is to find the answers to the questions. Okay, that is the simple answer, and you have to choose the correct answer option. Right, you have to choose the right answer option, and this can be done if you perfect your elimination strategy. So my advice is, instead of focusing on trying to find the correct answer, focus on eliminating the incorrect answer options, because that is little bit more easier in eliminating the incorrect answer options, and whichever answer option is the most difficult to eliminate, that will be the right answer. Okay, so that is a very good strategy, because on the exam in the examination hall, our mind is very different from the mind we have at home. Practicing at home, but doing the actual exam on the examination day is very two entirely different scenarios. So therefore, we need to be very, very cautious. Right. So there are several strategies. Now, there are some students, some people who say you read the paragraph first, and then you read the question, and then you find the answer. But I would not recommend it, because if you read the paragraph first, okay, there is no aim to your reading. You're aimlessly reading it. You're reading the entire thing. Okay, that is, you have to read the entire thing. And why are you reading it? There is no particular aim, just to understand each and every word you're reading it. And then after reading the paragraph, if you read the question, of course, you have to read the question, you have to do the answer options. And now once again, you have to go to the paragraph to confirm. Even if you know the answer, you cannot afford to take a risk, right? So you have to come back over here, and you have to confirm the right answer. So basically, what are you doing? You're reading the same thing twice, and that is a waste of time and a waste of energy. So if you read the question first, if you know what the question is asking you, okay, so here the guidelines require those undertaking a clinical medication review. So there are certain guidelines, and according to these guidelines, the people who are undertaking the clinical medication review, they must do something. Okay, so according to the guidelines, the people who are undertaking the medication review, they're supposed to do something. Okay, they may have, maybe this is what they have to do. Answer option A, B, or C. Now you see, you have a little bit more clarity. Okay, you have an aim over here. Okay, my duty is to find what the guideline is asking the person to do. And with that idea, and as well as a little bit familiarity of the answer options, then if you read the paragraph, you will be able to catch the answer little bit more easily, and there is no need for you to read it twice. Maybe if it is an easy answer, you just by reading it the very first time itself, you will be able to find the correct answer. So like this, you can save time. So that is why being a strategist is very important. Just knowing how OET works is not going to be enough. You have to have the right strategies with you. That is, you must know what to prioritize the questions first. Understand this is your duty, finding answers to the question. And with that knowledge, you have to come to the paragraph, read it, and try to eliminate the incorrect answer options. And whichever is the most difficult to eliminate, that will be the right answer. And again, there are certain things called comprehension, retention, detection, keyword analysis, verb analysis, and how to eliminate and all. That and all we'll be talking in very soon. Right. So this is the very first question over here. So how about you read the question? So should I? Okay, so let me just duplicate it so that it becomes easy. Okay, so I'll try to show you the question as well as the.
Shrikant, can you please repeat the last few points of strategy which you have just now repeated?
Yeah, I will repeat it. That is what I said is what did I say? Even I don't remember what I said. What did I say? I said, yeah, elimination strategy is very important. That is, you have to make sure that you're eliminating the incorrect answer options first, and you're prioritizing the questions first, and then you're reading the paragraph. Okay, I'll be repeating that. I'll be repeating that. No worries. No, I don't think it's a little bit lengthy question
So
over here.
that means before going into the question, before reading the question, we should first go to the paragraph
No,
and
that is no. First, we have to read the question, and then we
all
have to go
right,
to the paragraph.
and mark the keywords.
Yeah. Yeah. So I'll be talking about the strategies very soon. So first, okay. So this is a very lengthy question. I'm not able to zoom in. Okay. So first you do one thing. All of you read the question first, the fifth question. So try to do the question on your own, and then I'll explain it to you. Okay. So I hope the question is thorough in your mind. You must be able to retain the question. Now this is the paragraph. Okay. So I'm not sure if it is easy to read. So you can type the answer in the chat box. It doesn't matter if your answer goes wrong. Okay, this is a slightly tricky question. Participation is what important. I'll be giving you the strategies. Right. So let's talk about the strategies over here. So when we're dealing with a multiple choice question, you have to prioritize the question first. Okay. And there is a technique to do the questions. Understanding the question is important. So that is what we call as comprehension of the question. Okay. That is, if a candidate is not able to understand the question, then what is the point of reading the paragraph? Because paragraph has so many more words. So question has only this many words. And if a student is not able to understand the small amount of words in the question, then it is pointless to read the very big paragraphs. So always try to comprehend, that is, understand the question. And then you have to have a very good memory of the question. That is what we call as retention. Okay, so once you have read the question, once you have understood the question, you have to register this information to your memory. Okay, and with that memory, you have to read, that is, you have to detect the answer with an aim. So now you see, with an aim, you have aim. Okay, this is what the OET is asking me to find out. So with that focus, you have to read the paragraph. Okay, so you see the difference between reading the paragraph first and then reading the question and reading the paragraph, right? And then to comprehend the question, there is something called as the keyword analysis, right? So we'll be talking about the keyword analysis, and also we'll be talking about the verb analysis as well. Okay, verb analysis, that is identifying the verbs. And why is that important? It is important for refining the elimination strategy, right? So part B questions, even though it looks quite easy, it can be slightly tough, and multiple choice questions. So the biggest advantage you can implement over here is eliminate the incorrect answer options, right? So let's take a look into the fifth question over here, and let's do the keyword analysis. Now over here they have written the guidelines require. Okay, so require means what? Need. Okay, so the guidelines necessitates, or it is necessary. Okay, so according to the guidelines, it is necessary. Okay, for those who are undertaking, that means who are responsible. Okay, who are doing the job. Okay, those who are doing the job, or those who have taken the responsibility of clinical medication review too. Now, these are all activities. Okay, so according to the guidelines, the people who are doing the medication review, they have to do either answer option A, either answer option B, or answer option C. Okay, so A, B, and C are all what? They are activities. They are compulsory things. They are compulsory things that the patient, that the person must do. Okay, so there is no skipping. So guidelines basically means what? Rules and regulations. Now, what is the first compulsory thing that the person must do who is doing the review? They must involve the patient in their decisions. Okay, in their decisions. Now, who is there? Now, in OET, they really like to give these words. Who is there over here? Again, you can type in the chat box. Patient is there. Involve the patient in their decisions. Are you sure it is the patient? It is not the patient, huh? It is basically the people who are undertaking the review. Now you see the medical staff. So this is a workplace extract. So the guideline is basically instructing the staff over here. The guideline is instructing the staff. Okay, and the staff who are doing the review, okay, they have to involve the patients in their decisions. That is the staff's decisions. The staff who's doing the review, whenever the staff is taking any decision, they must always involve the patient. Okay, so it is not there. Okay. Now let's come to there refers to not the patient. Okay, so this is again, so this is a very common, trick of OET. It's quite confusing. Now let's come to answer option B. Consider the cost of any change in treatments. Okay, so if there is any change in the review, so when we do the medication review, if we are going to bring any change, okay, that is treatment from treatment option A, now we are going to treatment option B. So we have to see if there is any price difference. Cost basically means the monetary value. Okay, that is the staff. Okay, so that is the staff must consider. The staff must consider the price change of any treatment change. Okay, so this is an instruction to the staff. Okay, now what is the third instruction to the staff? The staff must recommend other services as an alternative to medication. So alternative, that is instead of medications, the staff must compulsorily recommend other services like maybe Ayurveda or maybe homeopathy or maybe physiotherapy. Like that, they have to, instead of giving medications to the patient, the staff must recommend other services. So like this you have to comprehend the question. You really have to understand the question. Only if you understand the question, your the paragraph will be easy for you. So I would always say don't rush through the questions. Okay, as I told you, like the questions may look very easy and innocent over here, but there is a lot of trickery behind it. There are a lot of layers to IT, and we need to have a very cool, calm mind to understand all that. All right, so understand the question, maybe give 10% extra effort. The questions are that important. And with that in knowledge, you have to read the paragraph over here. Right. So annual medication review. Annual basically means every 12 months. That is every yearly. Okay. Every year at the end of the year or something, there is going to be a medication review. Now the guideline. So this is something they have to do. The people who are doing the review, they have to do. So let's see what is the instruction over here. The instruction is to give all patients, that is, give each and every patient an annual medication review is an ideal to strive for. Okay, so ideal means what? Perfect. Okay, so here the document is telling, okay, each and every single patient, for each and every single patient, if every year we are giving them an annual medication review, that is a very, very perfect world to strive for. Okay, that is what first sentence is saying. In the meantime, there is an argument for targeting all clinical medication reviews to those patients who likely to benefit most. Okay, so here there is an opinion difference. So there is a difference of opinion. So what is the first sentence telling? The first sentence is telling we have to give all patients, that is a very serious patient and a very, very healthy patient as well. A very healthy patient, no serious conditions, but at the same time, a very serious, a very critical ill patient, no matter the seriousness of it, if it is a patient, each and every patient must receive an annual medication review. That is a very perfect thing. But at the same time, there is an argument. Argument means what? There is another set of people. Okay, and they are arguing. And what are they arguing? They are arguing that we must give all the clinical medication reviews to those who are going to get benefit. Okay, so see, let's say there is a very healthy patient, and giving that patient a medication review is not going to benefit the patient in any way. Okay, so instead of giving reviews to those patients who will not get any benefit, we must give medication reviews to those patients who will get the benefit. That is, we have to discriminate. Okay, so we have to discriminate among the patients, and who needs it, they must be given the review. Okay, so this is an opinion over here. Okay, so this is what we understand. Now let's come to the second sentence over here. Our guidelines. So the hospital is telling our guidelines state. Now, as you can see over here, this sentence, it begins with this quotation. Okay, at least, and it ends over here. Okay, so the reason why they use this sentence in quotations is because when we are exactly copying down a statement from another document, or when we are exactly copying a dialogue of another person, the writer will always use quotations. Okay, so here our guidelines state, okay, so the guideline is stating very clearly at least a level 2 medication review will occur. Okay, level 2 medication review basically means, see, phase 1, phase 2, phase 3, and all we have, right? So that is level 2. That is after phase 1 comes phase 2, level 2. So the guideline is saying that at least minimum a level 2 medication review will occur. In essence, actually, this is that, not that is. We have been trained to read it as that is. It is basically in essence. In essence, the minimum standard is a treatment review of medicines with the full notes, but not necessarily with the patient present. So, what is the guideline saying? Okay, minimum level 2 medication must be given to the patient. Okay, and what does that mean? What does level 2 medication means? That means, so this is a definition of level 2. Okay, so that is the, in a sense, this is, they're talking about the definition of level 2. So here they're saying the minimum standard, that is the minimum, okay, is a treatment review of medicines with the full notes. Okay, that is whatever medicines and full notes of those medicines, but not necessarily with the patient present. That is, the patient can be present, the patient can be absent also. Okay, so we have to give full notes of the medicines either in the presence of the patient or either in the absence of the patient. This is what level 2 medication review means. However, okay, so now this is a contrast phrase over here. However, the guidelines go on to say, now see, once again, this is coming in quotations, right? See over here, this word over here is coming in quotations because the guidelines are this is the exact words of the guidelines. What's the guideline saying? All patients should have the chance to raise questions and highlight problems about their medicines. Okay, that is each and every patient. Okay, each and every patient should have the chance, means they should have the opportunity to raise questions, that is to ask questions and also highlight problems about their medicines. So see, what is the importance? The patients are very important over here, and that any changes resulting from the review are agreed with the patient. Now see over here, what is the repeating word over here? Patients, and the priority that has been given to the patients. Now what is answer option A? Involve the patient in the decisions of the staff. That is, each and every decision the staff is making, the patients have to be involved. So that is what we read. Now see, this is the benefit of reading the question first, because if you read the question and if you have a thorough knowledge of the question, then when you're reading the paragraph, you will be able to click it. Okay, your mind will go click, aha, I have read this before. So we have read this before. That is involving the patients in the decision of the staff. Now, what is the guideline saying? What is the guideline requiring the staff to do? Each and every patient should have the chance to raise questions. That is, patients have a right to ask questions. Patients have a right to highlight problems about their medications and any changes. So the staff is doing any changes from the review, it must come from an agreement with the patient. That is, a patient has to agree to it. So they are giving patient the right to be involved in their decisions. So you can put a question mark over here. Now you see, you can put a question mark because this is what answer option A is, and that is exactly what we are getting over there. So you can put a question mark because it is likely to be the right answer. Okay, but we have not yet eliminated answer option B, and we have not yet eliminated answer option C. Right. So let's keep reading the remaining part of the sentence. Now let's see what they are saying over here. It also states. Now what does it refer to? Over here, what does the word it refer to? You have to really understand these small, tiny words. What does the word it refer to? What is the writer talking about? Yes, very good. Guidelines, right? So the guidelines. So the OET people, if they want, they can say guidelines also state. But instead of saying that, they want you to struggle a little bit. Very honestly, they want you to struggle. So that's the reason why instead of writing guidelines, I have written it. Okay, so the guidelines also state. So this is everything. So these are all what the guidelines are stating. See, guidelines state. Now here also they are using guidelines. It also states that GP practices are expected to. So here it is a guideline to the doctors, that is general practitioners. So here they're talking about what GPs have to do. Now, what are the GPs required to do? GPs have to minimize waste in prescribing and avoid ineffective treatment. Okay, that is, they must avoid ineffective treatments and they must minimize waste. Okay, that is the first instruction to general practitioners. What is the second instruction? Engage effectively in the prevention of health. Okay, ill health. Ill health means sickness. Now, what is the third one? Avoid the need for costly treatments. Aha. Now, the costly. Now, we have read that word, right? So, answer option B. What is answer option B? Consider the cost of any change in treatment. So, if any change in treatment is going to happen, then you have to consider the cost over here. So, as soon as you hear the word, read the word cost, you have to go to answer option B. Okay, so now let's read it fully. Avoid the need for costly treatments. That is, if there is a cheaper option, then prefer cheaper option. Don't prefer costly treatments. Okay, by proactively means very actively. Proactively means very actively. Okay, actively managing patients to recovery through the whole care pathway. That is, help the patients to recovery through the whole care pathway. Now answer option B. What is answer option B? Consider the cost of any change in treatments. So did we read anything regarding that? No, right? So now let's talk about the verb analysis. Okay, so what we did is, okay, so here the strategy is answer option A, you have suspected. Okay, now the verb analysis. Okay, so I forgot to actually do the verb analysis. Keyword analysis only we did, and then we directly went to the question. So let's do the verb analysis. So what is the verb in answer option A? Verb means what? Verb basically means any kind of an action. Okay, any kind of an action or any kind of an activity is what we call as a verb. So what is the action in answer option A? Right, so here, yeah, the first the verb in answer option A is involve. Okay, involve is the action. Okay, we have to involve the patient in their decisions. Okay, so the required for undertaking. Okay, so those who are undertaking the review, what they have to do, they have to involve the patients, okay, in the decisions. Now what is the verb in answer option B? Consider the cost. See, this is the action over here, right? That is, those who are undertaking the medication review, they must consider, means they must not ignore, they must give importance to the price difference from treatment option A and treatment option B. Now, what is the verb in answer option C? Recommend other services. So here, what are they supposed to? Recommend other services. So that is the verb over here. Now, let's do the elimination strategy. So like this, see, now it becomes a little bit more easier. So those are undertaking the review, they must involve these decisions, patients in their decisions. They must consider the cost and they must recommend other services. Right. Now, was this mentioned? The was and the verb, okay, is this mentioned over here? Yes, we have to involve the patients in their decisions. Okay, involvement, that is definitely mentioned. So we have a very strong possibility that answer option A could be the right answer. Right, now let's go to answer option B. Now here they have written consider the cost. Okay, so yeah, consider the cost, that is also mentioned. Okay, because what they have told you there, avoid the need for costly treatments. So yes, the verb is consider the cost because not every patient can afford expensive treatments. But what about this? So is this keyword mentioned over here? Any change in treatments? That is, if there is a treatment change, you have to consider the cost. That is not mentioned. They have told you to avoid the expensive treatments, right? So what you can do, the keywords are not mentioned, the verb to a certain extent is mentioned. Linking them together, we can say B is not the right answer. Now, what is answer option C? What is the verb over here? Recommend other services. So did we read anything about recommending other services as an alternative? So this verb and these keywords over here are also not at all mentioned. So answer option C, we can very, very easily eliminate. Answer option B, not very easy to eliminate, but still, if you think very clearly, yeah, the keyword is not mentioned and this is not what it means. So by default, since B and C has been eliminated and we suspect that answer option A is the right answer, answer option A will be the right answer. Right. So this is the strategy. Now you see over here the benefit of reading the question. Now see, we read the question, we comprehended the question. Now just by reading the first paragraph, that is, as soon as we read, this part over here, we were able to suspect that answer option A is the right answer. Right. And then when we reached this part of the paragraph, we were able to eliminate answer option C as the incorrect answer option B as the incorrect answer option. Now, this is the benefit of reading the question first. If a student is reading this, that then he or she will never be able to eliminate answer option A. I mean, choose and suspect A as the right answer and eliminate B. So what they have to do, they have to read this. There is no aim to their reading. Now, once they have to come back over here. They have to read this. And then to confirm, once again, they have to come back over here and they have to read. So there is a little bit more expenditure of time and energy. And when it comes to reading, time management is very, very important, right? So finding the answer, yes, will you get the answer by reading? Yes. If you read the paragraph first, definitely you will be getting the answer, right? But what is your duty here? To find the answers in the shortest time span possible. So your entire strategy must be centered around that. And you have to understand the keywords, the verbs. You have to comprehend the question. You have to register the information to your memory. With the aim, you have to read, and then you have to eliminate the incorrect answer options. And whichever answer option is the most difficult to eliminate, that will be the right answer. Right. So let's choose One more question. Okay, so this one is a slightly medium difficulty level question, not too easy. It's a slightly, you know what, question, slightly complex question over here. Right. So over here, the word chaperone. Okay. So I will explain the questions and everything, but first I want you to do it on your own. So the word chaperones basically means a person who is going to help the patient. So for example, if a patient becomes admitted, the patient will need someone to help them, right? Okay. Like an aide. Okay. So that person is what we call as a chaperone. Okay. That is a person who is taking care of the patient, who's helping the patient. That's what we call as a chaperone. All right, so I have explained the meaning of that. Now read the fourth question and read the extract over here as well. Yeah, 30 more seconds. Right. So what could be the answer to the fourth question? The guidelines establish that the healthcare professional should. Okay, so let's take a look into the question. Right, so let's take a look into the fourth question over here. What is the meaning of establish? Establish means what? To confirm. Okay, that is strongly something. Okay, establishment. That is a very strongly. Right. Yes. Right. So the guidelines establish that the healthcare professional should. Now, see, should basically means what? They have to do compulsorily. So the guidelines is giving a very, very strong instruction, to the healthcare professional. So according to the guideline, what must the healthcare staff do over here? Right. So let's take a look into the answer option A over here. So what are answer option A, B, and C? They are all compulsory things that the healthcare staff must do. Answer option A. Aim to make patients fully aware of their right to a chaperone. Okay, so these are the keywords over here. That is, so link the answer option to the question. Okay, so according to the guidelines, the medical staff should ensure, their ultimate aim, their main aim should be to make the patients fully aware. That is, give the patient the knowledge, to give all the patients the right knowledge regarding their right to a chaperone. That is, they have a right. Okay, they deserve a chaperone, and the medical staff have to inform this to the patients. The patients have to be fully aware of their right to a chaperone. That is the person who's going to help them. So that is the guideline telling them. Now, what is the guideline doing in answer option B? The guideline is saying the medical staff must evaluate the need for a chaperone on a case by case basis. That is, the medical staff should assess. Evaluate means what? Assess. Okay, they should assess whether a patient needs a chaperone or not. Okay, see, so healthy patients, do they need a chaperone? No, they don't need a chaperone, right? So on a case by case basis, okay, this is patient A, this is patient number B, this is patient C. So depending upon the case, they have to assess whether the patient needs a chaperone or not. So this is the instruction number B. What is C option over here? Respect the wishes of the patient above all else. That is above everything. Okay, above everything, the wishes of the patient is the most important thing. So the patient is saying, the patient is maybe the patient is a very serious patient. Okay, the patient is a very critical patient, but what is the patient saying? I don't want a chaperone. So you have to say, okay, fine. But if the patient is a very healthy patient, okay, and the patient is saying, yeah, I want a chaperone, then you have to say, yeah, I respect your wish, I will give you a chaperone. Right. So here they're telling whatever the patient says, you have to respect it and you have to give them that. Right. So these are the three instructions that has been given. Now let's do the verb analysis. Okay. So what is the verb in answer option A? Aim to make patients fully aware. Okay. So here the main aim over here. Okay. So the aim is the main thing. So anyway, make the patients fully aware. Okay. Make patients fully aware. That must be the aim. Aim to make the patients fully aware. That is what they have to do. Okay. Make patients fully aware of their right to a chaperone. So that is the verb over here. Now, what is the verb in answer option B? Evaluate. Okay. Evaluate the need for a chaperone on a case by case basis, right? So they have to evaluate whether a patient needs a chaperone or not. And how should they do it? By, studying the patient one by one, right? Now, what is the verb in answer option B, C? They have to respect the wishes. Okay, that is above everything, they have to respect the wishes of the patient. This is what they have to do. Now you see, it has become slightly small. Okay, make patients fully aware, evaluate the need, and respect the wishes. So see, the verb analysis makes it smaller and also more concise, and it becomes easier for the information to register to your memory. Okay, so now with this understanding, with this knowledge over here, let's read the passage over here. Now, see, with that retention, so you have comprehended the question, comprehension is done. Now you have to register the information to your memory, and with that memory, you have to read this. Now, extract from chaperones guidelines for good practice. Okay, so this is also a workplace related document. So from a very long document, they're taking one tiny extract over here. Now, what is the person saying? A patient may specifically request a chaperone, or in certain cases may nominate one, but it will not always be the case that a chaperone is required. Now, see, what is the first sentence telling? A patient may request a chaperone. The patient will say, yeah, I want a chaperone. Okay. Or in certain circumstances may nominate one. See, nomination. So Oscar nominee, Best Actress Award, Best Actor Award, Best Comedian Award, nominee number one, nominee number two, nominee number three. Okay, Oscar nominee, right? So like that, in some cases, the patient will nominate. Okay, I want my cousin to be option A. I want my neighbor to be option B. I want my brother-in-law to be option C, right? Like that, they can nominate. Okay, but that is only in certain cases. So in some cases they can request a chaperone, or in some cases they themselves can say, I want this person to be my nominee, right? But it will not always, now see, but it will not always be the case that a chaperone is required. So sometimes the patient may be a very healthy patient and they may not require a chaperone. But even if the patient does not require a chaperone, they might still request a person, or they may nominate a person. So that is sentence number one. Let's go to the second sentence. It is often a question of using professional judgment. Okay, so now what is the word it over here? The word it, what does it refer to? Again, you have to understand the trickery behind OET. What does it refer to? So those who don't know, the word it is referring to the requirement of a chaperone. Okay, this is what it is referring to. Okay, so whether a patient requires a chaperone or not, that is often a question of using professional judgment. Okay, so to determine whether a patient requires a chaperone or not, it is a question, that is, they have to use their professional judgment. That is, the medical staff, they need to use their professional judgment to assess an individual situation. Now, did we read this anywhere? Okay, what did we read in answer option B? Evaluate the need. Evaluate the need for a chaperone on a case by case basis, right? So see over here, evaluate the need. Evaluate whether a chaperone is required, okay, and how they should do it using the professional judgment, and how they should do it to assess an individual situation, that is an individual case by case, right? Now see, this is the benefit of reading the question first. Now, what you can do, you can put a question mark over here. As soon as you read the second question, you can put a question mark because you suspect B could be the correct answer because the verbs are mentioned. Evaluating the need for a chaperone on a case by case basis, right? So you highly suspect B to be the right answer, right? But we have not yet eliminated A and C. So let's keep reading the third sentence, right? Now, if a chaperone is offered, so we have now offered, okay, take your chaperone. Okay, but the patient is saying, no, I don't want this person. The patient is declining. So we offered the chaperone, but the patient is declining it. This must be clearly documented. Now, what does the word this refer to? What does the word this, what is the meaning of this over here? This must be clearly documented in the patient's record along with any relevant discussion. What does the word this refer to? It refers to the refusal. Okay, that is, we offered the chaperone, we offered the patient a chaperone, and the patient has now declined it. Okay, the patient is saying, no, I do not want this person. So if that happens, if the declining has happened, the declining must be the refusal. The refusal must be clearly documented. Okay, so if they want, they can write the refusal must be clearly documented. But here they are writing this. Okay, so this is what OET does. Okay, so train yourself to prepare yourself for these type of words. Okay, so the declining part should be clearly documented in the patient's record. Okay, that is, it should be written in the record along with any other relevant discussion. If there is any other important information that needs to be given over there. The chaperone should only be present for the physical examination. So when the patient is being physically examined, only that time the chaperone must be present and should be in a position to see what the healthcare professional undertaking the examination is doing. Okay, so if the patient is having a chaperone, they must be present only during the physical examination. They must be present there and they must be able to see what the doctor is doing. The healthcare professional, now see, now it is the guideline is talking to the staff over here. The staff should wait until the chaperone has left the room. That is the medical staff, that is maybe the doctor, maybe the nurse, maybe the pharmacist, maybe the physiotherapist. They have to wait until the chaperone has left the room. Cubicle means room, a small chamber, before discussion takes place on any aspect of the patient's care. So if the medical staff wants to have a discussion with the patient, they have to wait until the chaperone has left the room. The chaperone must go away unless the patient specifically requests the chaperone to remain. Otherwise, the patient must request that the chaperone remain there when they're having a discussion regarding the patient's the care of the patient. Okay. So now you have understood. Okay. So like this, so on your examination day also, if you're writing the paper-based OET with a pencil, you can underline the important words like this. Those are writing the computer-based OET, you can highlight words like this. Okay. So if you do the sample test, you will be able to highlight the words like this. Now, let's take a look into the fourth question over here. The guidelines established that the healthcare professional should. What is the answer? Option A. Aim to make patients fully aware of their right to a chaperone. So, what is the aim over here? What is the verb over here? Make patients fully aware. Now, let's just come to the paragraph over here, right? So, the verb, okay. So, now sometimes you have to go back and forth. So, is the guideline telling that you have to ensure that each and every patient knows that they deserve a chaperone? Okay, make the patients fully aware, that is provide awareness, provide knowledge. Okay, so as you can see over here, that verb is not mentioned. Okay, that they have a right to a chaperone and patients must know that. Okay, so this particular verb over here, okay, the awareness part, giving awareness to the patient, it is not mentioned anywhere. As you can see, it is not mentioned. So since it is not mentioned, we cannot choose answer option A, right? And answer option B, evaluate the need. So this is the verb over here. So evaluating the need for a chaperone, that is mentioned, and on a case by case basis, that is on an individual basis, we have to evaluate the need. So as you can see over here, the keyword is mentioned and the verbs are mentioned. So you strongly suspect answer option B to be the right answer. Now, what is answer option C? Respect the wishes above all else of the patient. Now, respect the wishes of the patient. Is this mentioned anywhere? That is, you have to, if whatever the patient is saying, you have to respect the wishes. So that is also not mentioned. So this is not mentioned over there. So you can eliminate answer option C. Now, A and C is eliminated. So the least likely to be eliminated is answer option B. So by default, B will be the right answer. Okay, so this is also a slightly complex question, not a very easy question actually. So you need to have the thought clarity like this. So you need to have the right strategies. Now you see over here the benefit of reading the question first. So see, just as soon as we read, so let me just do everything over here. Now see, to assess an individual situation. Okay, so over here, I think chaperone. Now you see, this is where the answer located. That is, if evaluate the need for a chaperone using a professional judgment and assessing it on an individual, that is case by case basis. So just by, and this is coming in the very beginning portion. Now it's coming in the very beginning of the portion. And in the very beginning itself, if you're able to say, yeah, B is the right answer, then you see over here, this entire portion, you don't have to read it with a lot of effort. You don't have to read it with a lot of tension and stress, because you have highly suspected this to be the right answer. Okay, so this is another benefit of reading the question first. You will be able to save your time and energy like this. But yeah, you have to definitely read it just to confirm, because there are three answer options here. So we have to make sure that we are able to eliminate the other two answer options. Right. So the elimination strategy, the verb analysis will help you out. And again, comprehending the question is very important. So let's take a recap of the entire things that we said. So in reading part B, do not underestimate the questions. I personally find part B questions to be more complex than part C. Again, everyone has their own perception. Yeah, I'm not saying part C is easy. Part B is also has easy questions. Part C also has easy questions, but part B as well as part C has difficult questions. But the language in part B is a little bit more indirect. It is a little bit more tricky. So even though they have only three answer options, that challenging factor is still there. So you have a choice. If you feel like part C is difficult, you can directly begin with part C first, and then you can do part B, or you can do part B first, and then you can do part C. So how much time do you have? You have 45 minutes time. Okay. So in part B, you have 6 questions. In part C1, so there is extract 1, and there are 8 questions there. And then we have extract 2 of part C, and there are 8 questions, right? So I would suggest that you spend about 16 minutes, okay, 16 minutes for one extract, okay, and another 16 minutes for extract number, the second extract over here, and that leaves to maybe like 13 minutes, okay, 13 minutes for question. That approximately leaves you with 2 minutes per question. Okay, so this is very, very important. If a question is taking you more than 2 minutes, skip it. Okay, do not stay on that question. Okay, that means it is a very time consuming question. So if a question in part B or part C is taking you more than 2 minutes, that means that is a very tricky question. Skip it and go to the next question, right? And then after you have done all the easy questions first, then only you have to come back to the difficult questions and you have to do the difficult questions last. Okay, so in reading, you have that freedom. You can choose in whichever order you want to go, right? So no more than 2 minutes. 2 minutes is ultra maximum that you should spend on one question. Within 2 minutes, ideally within 1.5 minutes, 1 minute itself, you have to be able to pinpoint the correct answer, but don't hurry. Okay, because you see, so we did two questions today. Okay, so only if you put in effort, only if you think very clearly, only if you comprehend the questions, only then you will be able to, grasp the information from the document. So don't hurry. Okay, read with clarity, think very calm. Okay, you will become anxious, you will become nervous, you will become distracted, and you will become tired. OET is a very tiring examination, but as long as you're calm, as long as you're composed, as long as you're thinking very rationally and logically, and you're implementing the right strategies, and you're making sure that you're not spending more than 2 minutes per question, it is going to be a relatively easy or manageable thing. Okay, so like that. So that is about reading part B. Okay, and then when you're doing a multiple choice question, comprehend the question, prioritize the question, do the keyword analysis, do the verb analysis, register everything to your memory. You need to have a very good memory of the question. And with that memory, with that focus, you need to read the answers, I mean, the paragraph. And as you're reading the paragraphs, make sure that you are underlining the important words and so forth, right? And then try to eliminate the incorrect answer option. Sometimes if it may be a very easy question. So if it is a very easy question, then yeah, you can choose the right answer immediately. But that is not always the case. Sometimes it may be a difficult question. Sometimes it may be a medium difficulty question. So in that case, it is a very foolish idea to try to choose the right answer. Instead, try to eliminate the incorrect answer options. One can be easily eliminated, but one will not be very easy to eliminate. So among the two, again, sometimes you have to refer back. So multiple times you have to refer to the paragraph and eliminate the incorrect answer option and choose the right answer and then go away. Okay, so those are rules. Writing the pen and paper based OET, you have to like this, you have to like shade the correct answer. So if you believe B is the right answer, with your pencil, you need to shade B. So writing the computer based OET, you just have to choose answer option B. You just have to like highlight it. Right. So that is the class regarding reading part B.